Hi, everyone who's already here with us. We're still backstage right now, hanging out with the speakers. We've got Joelle. Wait, Joelle's here.
Yeah.
And Howard and Ren and Joey.
Hi.
Hi everyone.
Everyone.
Hi.
So yeah, before we begin, I have a question for both the live audience and also our speaker. We were wondering, how have COVID-19 impacted you so far?
Oh, I miss the great outdoors and the sun.
Me too.
Oh,
Yeah.
don't we all? I miss going out for a walk and not looking at everybody with their face mask on. But I imagine in Taiwan for you, Howard, everybody is normally in face mask anyway, no?
Yeah, actually our government doing pretty good. And for me, I think nothing changed because most of the time I stay at home. Not just the virus, that's just because I need to take care of my daughter. So that's fine. Yeah.
Ooh.
That's nice. We've seen it a lot as well. When we asked developers, is there any difference? They were like, no.
How's the situation in Taiwan?
Hmm?
How's the situation in Taiwan?
This situation?
Yeah.
I think that people were not less scared like the other country. Yeah, and the government will give the newest information and do a lot of things, and also the civic movement do a lot of things to deal this situation. So everybody will be, I mean, not that nervous at this situation.
We have some folks on YouTube and Facebook saying hi to everyone as well. And we have Julie who says that she's happily growing horizontally.
Hey, I saw the curve.
Okay, awesome. So,
all right. Well, we're probably going to get started, so we'll move everybody backstage again, and then we will welcome everyone and get the program started. We're very excited to have everybody telling us about the projects they are working on today. All right, see you all later.
Yep.
All right, welcome everyone for joining us today at Lakopi Online. Hi. Oops. Hi, I'm Janice.
Hi. And I'm Joey, and we're both from the Google Developer Relations team.
So thank you for joining us at our second Lakopi Online, except that this time we're not in Google Developer Space. As you can see, we're both working from home. I hope you're keeping yourself safe and well at home and brought along your own pizza and kopi tonight. We've got our kopi. So this month, we're really heartened by the tech community's effort in mobilizing itself to combat COVID-19 together. So we decided to feature some of these amazing developers in our community to share about these extraordinary projects that they have been working on to overcome these issues in the region.
Yeah, so in case we have new friends joining us here today who have never had the opportunity to join our past 9 Lakopi, so today Janice is our 10th Lakopi at Developer Space. Let me share a little bit about what we do and who we are. So Google Developer Space is a home for developers and startups from around the region to learn, connect, engage, and be inspired. Last year, we engaged with over 15,000 developers in person at our 180 event here in Singapore. We want to empower and connect our community to the people, programs, network, and technology.
So
Lakopi at Developer Space is our monthly open night where we select a tech team and speakers submit their topic to share about their best practices, projects, and ideas built on Google Developer Tools.
So this month, we'll be sharing about overcoming COVID-19. So without further ado, let us introduce our 3 speakers tonight. We've got Joelle Keck, the software engineer of GovTech, talking about behind the scenes in looking at Trace Together app. We've also got Ren Lee, who's the head of engineering at MindDoc, and it's a local startup here. And their project is all about curing the fear of coronavirus. I love this one, homegrown startup. And last but not least, we've got Howard Wu, all the way from Taiwan. So he leads the Tainan Google Developer Group there, and he's been working on the Taiwan's mass inventory and rationing platform. We're super excited to have all three of them here joining us tonight. But first up, we've got Joel from GovTech. Joel and his team has been developing Trace Together, the first contact tracing app created for this pandemic crisis period. His team has also shared a white paper and the Blue Trace protocol that is open source for the international community to develop and adapt it to their contact tracing needs. So without further ado, and not to steal his thunder, over to you, Joel.
Thanks, Joey and Janice. I hope everyone's staying safe and taking care. I'm here to give you a behind-the-scenes look at Trace Together. A bit about me: I enjoy baking and long walks, although now I'm reduced to pacing around my living room every day. I work at the Government Digital Services team, where we build tech for public good. So some background about contact tracing is useful before I delve into Trace Together. The idea of contact tracing is to identify people who have been in close contact with an infected person, and then to contact them to provide early detection, right? So they can cut the virus transmission chain. However, there's some limitations here. Number one, you're limited to contacts that a person is acquainted with, limited to contacts that a person remembers, and also it's quite high effort to be tracking down all these contacts and obtaining phone numbers. So what Trace Together does is we supplement the contact tracing process in Singapore and address some of these limitations. The idea is actually quite simple, right? It's using Bluetooth to log encounters between mobile devices. And now some people ask, why Bluetooth, right? There's so many other technologies, especially why not GPS? And I think the most important thing is Bluetooth is a bit more effective at determining close physical contact. If you're in a 30-story apartment block, everyone in the building would be within a margin of error for a single GPS point, right? Whereas Bluetooth, it's really about the people close to you, and the virus ultimately cares about who you're with, not where you are. It also doesn't hurt that Bluetooth uses a bit less battery. Now that sounds cool, but people ask, will the government know who I'm with all the time, or will malicious third parties be able to track me? And so that's really at the core of our product, right? How do we architect privacy-preserving contact tracing? I'll give you a walkthrough through how the Trace Together technical journey works. It starts with user registration, right, where the user signs up just with a phone number, and then we generate a random user ID and associate this with the phone number on the server. This is the only thing that the server stores, the user ID and the phone number. Now the key question is, what messages should the phones exchange, right? There are some requirements here. Number one, we want to make sure it doesn't reveal the user's identity. Number two, we want to make sure it doesn't contain static identifiers so that users cannot be tracked over time. Most phones today implement Bluetooth MAC address randomization precisely to prevent this. And we don't want to be working against these safeguards. Number three is also to prevent impersonation attacks, right? In Bluetooth, you don't have SSL. And so someone can just take the message and rebroadcast it. And you don't want people to be impersonating others because it kind of messes with the data. So what we do is we have the phones exchange this thing we call a temporary ID. And you can see the format of the temp ID here. It's actually very simple, right? It's a user ID, which we talked about before, with a validity period, which is indicated by the start time and end time here. These three fields are then encrypted with a secret key that's only held by the health authority. Because it's encrypted, it does not leak user identity. This validity period, the temp IDs are only valid for 15 minutes. And so every 15 minutes, we use a new one that has a different IV. The IV is kind of like a nonce. That means that every 15 minutes, the phones are broadcasting a different message, right? Which means that they cannot be tracked over time. In order to prevent impersonation attacks, right, the validity period is also useful here because it means that if someone steals your temp ID, right, someone is near you and then he or she picks up your temp ID and then wants to rebroadcast it, the temp ID will only be valid for 15 minutes anyway. And so it's a very limited attack vector. Because we encrypt using a secret key held by the health authority, this is all generated on the server, and then we kind of batch it up and then send it down to the device. A common question here is why are the temp IDs generated on the server as opposed to on the device? You can imagine some public-private key cryptography to generate them on the device instead if you give the user ID to the device. And I think the reason for this is we found limitations in background compute when the app is in the background. So in terms of continuously generating something on the fly, that was something that would hit the compute limits. Next step is if a user is infected, right? Touch wood, if somebody gets infected, what happens is they upload all their data, encounter data from their device to the server. This consists of the TEM IDs, the RSSI, device models, and then the algorithm then filters for close contact. TraceTogether is really designed for the Singapore context, where we have MOH doing a central manual contact tracing process. And so this data point is something else, another data point that the contact tracers look at when they determine who was likely exposed to the infected person. The Ministry of Health will then follow up and provide any medical guidance and care. This is a peek at the dashboard we use for the contact tracers so that they can determine, right? It's for them to visualize what the app flags out as close contact. And I think there were quite a few parts to this architecture, but the whole intent was to ensure we can preserve users' privacy. We don't want to collect, we collect very limited user personally identifiable information, right? We only have the phone number on the server. It's securely stored by the health authority. We store all the encounter history on the device. And there have been various audits of this, and we open source our code. So everything is stored on the device. Only when the infected person chooses to share it with the health authority, then the health authority will be able to see who you've encountered. Third parties cannot use the Bluetrace communications to track users over time, and this is what we talked about, not having a static user ID or a static message that's being sent. And the last thing that we didn't touch on is also having users in control of their data and being able to withdraw consent and delete data. Because the user ID and mobile number are on the server, it means that if the user requests to not participate and delete their data, we can delete that. And that means that all the TEM IDs that was exchanged with other devices and stored on other devices now becomes useless, right? And so the user can revoke consent. Some of the technologies we use, we actually do a lot in Firebase. We do our auth and we use the cloud functions, and it basically powers our mobile app. We use Swift for an iOS app and Kotlin for the Android app. We use native apps because we were going into the Bluetooth technologies, and it made more sense to be using the native code. We also use TypeScript and React for the contact tracing dashboard. I'll touch a bit on the technical challenges we faced. I think there are a few groups of them. I'll just show you a couple of photos. I think number one was getting Bluetooth to work reliably across different devices. And this is a look at part of our device farm, which our quality engineer Han Yang manages very tends with care. Like he lovingly wipes the screens of each of these phones every single day. But basically every device behaves quite differently, especially when it comes to hardware related things like Bluetooth, right? And so we have to end up, they optimize for battery differently, the way they send signals at different transmission powers. And so there was a big technical challenge we faced. If you look at this graph, you see that different devices are transmitting at quite different transmission powers. And the RSSI difference, RSSI is receive signal strength, the difference can be up to 20 or 30, and that, because this is a logarithmic scale, it means that it's 100 or 1,000 times difference. So the calibration by device is very important. How do we do that? How do we get this graph? We actually went to an anechoic chamber. A-Star was kind enough to lend us, allow us to use the anechoic chamber. And basically it's this like soundproof, Bluetooth-proof room so that you can test the transmission powers of devices in a controlled environment. The photo on the right is the spectrometer we were using. And then we use the reference calculations we get at these 2 meter distances. We use that then to calibrate the RSSI values to receive, which is also why we send the device model when we are exchanging messages with other devices. Another big challenge was running trials and just tuning the algorithm, right? I think at GovTech, we were very used to like CI/CD and automated testing, but it's impossible to automate a test when it's ultimately about Bluetooth, right? You need your devices to be in certain positions relative to each other. We cannot just run. I mean, we're very used to just running CI/CD automated pipelines, and we realized that did not work here unless we had. I think now we're starting to explore maybe having device farms where the devices are in fixed positions, but that was just not feasible to get set up at the start. And so some of the trials we've been running. So on the left, you see a debug view that we put in the device, right? So when the devices are moving around, they can be tracking, that they're talking to the devices near them. On the right was one of our static controlled trials. We did a few different kinds of trials. This is one of the kinds. It's called a static trial, where basically we have the devices in different clusters. Here you have 3 different clusters. Sometimes we put them in bags so that it simulates real life conditions. But basically they're in different clusters, and basically you get very good labeled data from this, and then you use that to test the algorithm and make sure that the system can flag out close contacts as desired. This is a bit more involved, like human organic trial, where basically we give everyone a timetable. We say, okay, at this time, can you meet up with this other person? And then we give all the data to somebody else who was blind to the whole setup, and then see whether they can predict see whether the algorithm can predict the close contacts. I think and so yeah, it was a lot of work for the whole team. But I think ultimately what we do as engineers and designers is nothing compared to what the frontline officers, the frontline medical workers are doing every day. But I think a big thing for us was also that technology, although it's not the solution itself, it can be part of the solution, right? You have tons of things that GovTech is working on, your Gov.sg WhatsApp chat, right? The temporary relief fund sign-up forms, right? There are all these things where technology can be part of the solution to help combat COVID and help also support people, right, as they are dealing with COVID. You can check out our code, as embarrassing as it may be, at github.com/opentrace-community. You can also read our white paper where we delve a lot into our design considerations at bluetrace.io. Now back to you, Janice.
Thank you, Joel, for this super insightful sharing. I'm sure a lot of the developers will be thinking of, wanting to go and try their hands on this right now. We already have some questions for the event. So, sorry, and here's one for you from Shi Chao. So have you guys tried to do silent push notifications to trigger a refresh of the app for iOS?
Shi Chao, that's actually a really good idea. And we tried everything, including silent push notifications. The thing we found is there are different sets of limitations on iOS. It's not just the limitation of background compute. It's also the fact that when the app is in the background, it advertises and scans for Bluetooth in a different way. For example, it advertises in a proprietary way. And so just getting background compute was not enough to overcome the limitations in iOS. Fortunately, Apple and Google are now partnering, right, on providing a set of Bluetooth contact tracing APIs that will overcome these limitations.
Thank you. We actually have a lot of questions on the live chat, but let's see, which one shall we tackle next?
Okay, here is one regarding battery drain. This is by Julie Kilwa22. Sorry if I'm pronouncing this wrong. How's the battery drain when you need to keep connecting between multiple devices and waking the phone at least every 15 minutes?
Yeah, this is something we tested rigorously. Actually, we did a lot of user testing before we went out, and actually the number one concern that people had, and we expected it to be privacy, but the number one concern people had was battery drain. And so we paid a lot of attention to this in our testing. We found that over a whole day's use with many people around you, your battery life is impacted by about 3% on the average phone by Trace Together, and I think we were quite okay with that trade-off. It turns out that Bluetooth Low Energy, it's called Bluetooth Low Energy for a reason, right? The Bluetooth Low Energy spec, which is the Bluetooth 4.0 spec, is actually quite low energy, and so it's able to do this scanning and advertising in a way that doesn't use so much battery.
Okay. Do we have more time for another question, Janice?
We do actually, because Joel wrapped up really quickly, so I think we can do one more questions perhaps.
Let's see.
I see a question on how does Trace Together from Frank Teal.
From Frank Teal. Okay, so this is from Frank Teal on YouTube. How do Trace Together handle 15 minutes for those who don't have mobile data connectivity, e.g. prepaid card user when they are out from Wi-Fi connection?
Yeah, this is something that was not addressed in the first release of the app. And it's feedback that we got from users, especially users who, maybe some soldiers who go out of field, right? Things like that. And what we changed the protocol to is we ended up batching these TEM IDs, because these TEM IDs are generated on server and sent down, but and they have a validity period to them, right? But you can kind of batch, forward generate TEM IDs for a whole day and send that down to the device at once. And we found that, in Singapore, we found almost everybody gets the data connection, at least once a day. So that addressed our problems.
Okay, thank you very much, Joelle. There are actually a lot more questions for you happening in live chat. So while we take you off backstage, if you don't mind just popping into live chat and answering some of these questions, and we'll be bringing up our next speaker.
Thanks,
Thanks, Joey
Joelle.
and Dennis. I'll be
Thank
back.
you.
Take care and stay safe, everyone.
All right, so next we have Ren. Ren heads up engineering at Singapore's telemedicine provider, MyDoc. So on Valentine's Day, MyDoc launched cureyourfear.sg to provide complimentary virtual coronavirus triage assessment service by licensed doctor here in Singapore. So I'll hand the time now over to Ren, who'll share about how MyDoc is leveraging Google Cloud to build an efficient and scalable platform to support the needs for medical consultancy in Singapore, and I heard also beyond our island. So over to you now, Ren.
Good evening, everyone. Thank you, Janice, Joey, and Google for inviting me to this event. It's a privilege to be here. Today, I'll share about how MyDoc cures your fear with Google Cloud Platform. Let me give a quick introduction to MyDoc. We are a Singapore-based, homegrown digital healthcare provider. We provide an integrated online to offline healthcare ecosystem. What this means is that our users start the whole experience on our apps on Android, iOS, and web, while they can consult the doctor through video calls, and if required, they can be referred further to a clinic or specialist or even to the hospital, right, to continue the consultation. What's great about this is that the whole process starts online, especially relevant during this current circuit breaker period in Singapore. You do not need to step out of your house and you can consult a doctor. We are also very honored to be awarded recently the 2020 Singapore Telehealth Company of the Year by Frost & Sullivan. It's a great honor. How is MyDoc helping with the COVID-19 situation? On 14th of February 2020, this year, on Valentine's Day, we launched the COVID-19 clinic. Right? Initially, it started as a local public service campaign in Singapore only, but we have received a lot of interest from countries around the region, and we have since then expanded it to other countries in the world. So this has become a global public service campaign to cure your fear. How is this possible? This is largely thanks to sponsorship from our employees, our friends, and our corporate partners. Thank you so much for your support. What is the COVID-19 clinic? This is a triage assessment service that is created specifically in response to the COVID-19 outbreak. At around late January and February this year, right, there's a lot of fear that's rising, and there's still a certain amount of fear nowadays about what is COVID-19. Where if I have symptoms like slight flu symptoms, if I'm running a fever, do I have COVID-19? So MyDoc, we started this service online so that users and patients can consult doctors in a safe environment to cure their fears, to address their biggest concerns. So we have a dedicated team of Singapore licensed doctors who are highly respected in the world, who will assess your risk, assess your concern, and help allay your fears over flu-like symptoms. We are also in a regulatory sandbox with the Singapore Ministry of Health. So MOH has very strict guidelines around patient safety and welfare. So being in the sandbox with them, right, gives you further assurance about your health and safety. Who is eligible to use it? Anyone who may have respiratory flu symptoms or has concerns that they would like to address regarding the COVID-19 virus, you can use our clinic. The clinic is ready to provide timely triage assessments to alleviate any worries that may stem from misinformation. Well, especially currently online, there can be a significant amount of misinformation and fake news. And we want to help to reduce this and also help with solving and reducing the general panic associated with COVID-19. Okay, so let's get started. I'm going to pause at this slide for a while. So if you want, you can use your phone or point your phone camera or your barcode scanner at the QR code on the screen. Right? This will redirect you to this URL, join.md, MD for MyDoc, /COVID-19. This will bring you to the landing page where you can join the COVID-19 clinic. I'll pause for a few more seconds in case you need more time to bring out your phone to scan the QR code. Okay. After scanning the QR code, you'll reach the landing page where if you already have a MyDoc account, you can sign in, or if you do not, you can create an account immediately, and then you can sign in, and there will be a list of public groups for you to join. One of these public groups is the COVID-19 clinic group. Join it by clicking it, and you can start scheduling a video consult with a Singapore licensed doctor. So here we have an example of what a video consultation on your phone looks like. Over here, we have a patient who's talking to one of our doctors. He looks really reassuring. I'm reassured already that I'm fine. So yeah, so take the opportunity to sign up and start scheduling appointments with our doctors. I do want to highlight, especially during this period, our doctors are heavily overloaded, right? So please be patient with us if you need to wait for some time before to get scheduled with a doctor. Please bear with us in the meantime. More information about this COVID-19 clinic. It is provided by Singapore-based doctors and is open daily from 8 a.m. to 10 p.m. Singapore time. The assessments are conducted mainly in English with limited availability in Chinese, Malay, Thai, and Vietnamese. The details will be requested during your first consultation and viewable only by the healthcare professionals attending to you on MyDoc. What happens if a patient shows COVID-19 symptoms? During the assessment, you will be evaluated based on the risk of being infected with COVID-19, and you will be advised on precautionary measures. If a patient is determined to meet any case suspect criteria or is suffering from any moderate to severe symptoms, they will be triaged into a higher risk category, and the follow-up action will include going to a hospital or clinic in person. What other services does MyDoc provide? We offer a 24/7 medical triage service to assess your health condition. You can schedule an appointment at any time of the day. We offer 24-hour online GP consultations, and we also provide digital prescriptions, medical certificates, and specialist referrals. Next, I'm going to share about how MyDoc scales with Google Cloud Platform. We operate in 8 countries in the region, and we are still expanding globally. Google has been a great partner to us, and we are a big fan of Google Cloud Platform because ever since we switched to GCP, it has enabled us to scale very seamlessly and expand to many different regions in the world very easily. An overview of how we use GCP, our core administration applications, authentication, communication, and static image services are all hosted on GCP. We use GKE, Google Kubernetes Engine, to deploy, scale, and manage our applications in containerized environments. We also use Google Stackdriver, which is great. It's very powerful. It has very powerful monitoring, logging, and diagnostic features. It enables us to scale with confidence. This is a simplified overview of how we use GCP and all its components. So on the left, we have all our apps on the different platforms, Android, iOS, and web. And there's a variety of services that we use. Cloud DNS is great. Google DNS is one of the most resilient services in the world. Well, sometimes when we encounter any DNS outage, one of the first advice is to switch to use Google DNS. That shows how resilient and reliable Google's Cloud DNS is. We use cloud load balancing. Well, it comes with really dynamic load balancing features where, coupled with GKE, Google Kubernetes Engine, it allows us to load balance and auto scale very effectively. We also use Cloud IAM. This provides enterprise-grade access control management, which is very, very important in a very complex infrastructure environment like ours. We use Google Cloud Storage extensively. We generate a significant number of documents, e-prescriptions, referrals, right? All these are stored securely on Google Cloud Storage. We have a significant number of nodes on Google Compute Engine, and coupled again with GKE allows us to auto scale very effective to serve multiple markets around the world. GKE, it supports fast rolling deployments with zero downtime, which has been very effective for us. Previously, before we switched the provider, we had to suffer up to 2 hours of downtime. Today with GKE, there's zero downtime when we do rolling deployments. Our Kubernetes clusters are also deployed close to groups of users around the world to minimize latency. For example, we have users in Hong Kong, for example, right? Those clusters will be deployed in the regions as close to them as possible. Auto-scaling pods, so we set it to be based on 80% CPU utilization. So whenever they exceed that CPU utilization, additional pods will be added, right, to support the workload. Cloud load balancing. So it has a globally balanced IP addresses, well, for all our internet facing services, and data is routed to the nearest region, reducing the latency to our users. We have achieved great results by using Google Cloud Platform. We have observed increased API speed by 7-fold compared to our previous cloud environment. We have gained the ability to deliver updates without downtime, which is great for a 24/7 service like my dog. We have also achieved pricing flexibility to support cost-effective scaling. Thanks. Back to you, Joey and Janice.
Thank you so much, Ren, for flying the flag for Singaporean startups. Love it. So we have questions from the audience. I thought I'll merge this one because from the same person, if you can help to answer that. So the question is my dog under Smart Nation roadmap? And is there features like anonymous rating for different assessments?
Currently, we are still assessing our roadmap. So no, we have not worked with a Smart Nation roadmap. But in terms of sharing data, no, we do not share patient data with MOH. Yeah.
Okay. We also have another question from Prem Kumar on YouTube. Will my dog share its data with MOH?
I think.
Oh yes.
I'm sorry.
Yeah, we don't. Yeah, we don't. Yeah.
Sorry, there's also the same question from Prem. So how does it help in identifying potential cases?
So this is actually I'm not necessarily qualified to answer this question from the medical angle because I'm not a doctor. So it depends on during the video consultation process. The doctor will ask about symptoms, will ask about how is the patient, what kind of recent travel history and contact do they have, and they will use their medical knowledge to do a triage assessment. If needed, they will advise the patient to go to a clinic and hospital for a follow-up.
Thank you, Ren. I'm sure there'll be other questions that pop up later. If you don't mind just jumping into the live chat session and help to answer some of these questions. Thank you so much for joining us today. And of course, the audience is still with us. Last but not least, we have Howard, who leads up the Google Developer Group in Tainan. And he will be sharing how he initiated a mass inventory map project with Google GPS and Places API that track mass stock in drugstores and convenience stores all around Taiwan. So hear how he built this platform and led this community initiative to help the people cope with the virus outbreak. Now,
Thank you. Hi, I'm Howard from Taiwan. Thanks, Jenny and Joey. Today I will give a story about my side project. And mask inventory map is that people can open the browser. It will show the user location and the place around the user who can buy the mask. If you're talking about a mask map, actually there are two versions for Face. And the first version, I'm the first person and the only person who made the map. The current online right now is the second version. At the end of January, Taiwan government set a mask export restriction. Only allow convenience store can sell the mask. Every people can buy 2 masks, but it sold out so quickly. Because at that time, the mask can produce was around 3 million per day, but there are 23 million people in Taiwan. It's far not enough. So at that moment, people are very panicked and seeking the mask. At the midnight of February 2nd, I made a map for my family and friends. They can easily to check if convenience stores still have masks or not. I made a prototype, use Google's Vice, and this prototype took me around 6 hours. I released it at 10 in the morning. Here's the idea. I use the Google Map API and Place API. I'm thinking that if I want to show the convenience store around, I need to have the store data. But at the moment, there are no open data for convenience store location. So I can ask the Google Place API for that. I code API with my coordinate and get a convenience store around. I will see the store point on the map. Maybe click one of them and I can give the report if the mask is still available or shortage. And this one, it was the map look like it's my first version. You can click the store and show the report record. So this version, the inventory is come from crowdsourcing. When it published, people are crazy sharing. Every media and TV channel report it. Therefore, the page view growing so fast. Actually, I would never expect this situation. And this is Google Analytics. As you can see, the service start at 10 a.m. and end at the 5 p.m. It's 7 hours. The total page view made in these 7 hours is around 550,000. That's a quite amazing number. But here is also came the problem. I know API has price, but I didn't expect the huge usage. The pricing of Place API is $30 per 1,000 requests. The first day took me over 20,000 billion. It could already buy a car, yeah. So that's the reason I decided to close it at 5 at the first day. Then I decided to restructure the project. The most important that is to remove the Place API. So it took another midnight and reopening at next day morning. And then something happened. At the night of the second day, the government said that it will not sell mask in convenience store anymore, start from tomorrow. Instead of convenience store, it will change to pharmacy. So that means it's a 2-day project. 2-day live project. 2-day live with 550,000 page view. 2-day live with over 26,000 billion. Actually, the total online time might less than 24 hours. And Taiwan Digital Minister Audrey Tang Feng saw my map and report to the premier. She suggests the government should release the number of mask inventory, make it as open data. She also delivered the information and plan to Gazero, the Gazero Stack in COVID-19 channel. There are 500 people right now in the channel. Everyone provides their knowledge and skill to do something cope with the virus. And then it became the biggest online hackathon ever in Taiwan. It is really surprised that the first version of the inventory map inspires so many people during the hackathon. The API format was confirmed at the February 5th, and then the application need to be online at February 6th, 10 in the morning. That means everybody need to work in this project at midnight. When I done the first version, many GDG partners told me, bring them if there is another chance. So we group a team for the second version. The first version, I'm the only developer, and the second version, we got the team building. It's my pleasure to work with this team member. We have Angular GDE Kevin for the front end. We have Cloud GDE Cache for the back end. We have GDG Taichung and the Kaohsiung organizer Ada and Zhigang for Android and iOS app. We have LG GDE and GDG Taipei for supporting. And we also have Erica and Teresa help us to get a credit. That's very important things. And there are so many applications came from this hackathon. At the February 6th, the first day morning, there are around 30 different applications came out. Until now, there are already over 130 applications on the list. So we might can check here. So here we can see for the map application, we got 60 on the list. For Livebot, we got 21, and the chatbot for 3, and the map information for 23, and for mobile app, my 23, and the voice assistant is 5, and the others, yeah. So that's quite amazing because this hackathon, it's so many applications came out. And we can check this one. This one is the current version, the second version online right now. So people can open the browser and you will see the point. This one might have the 24 mask left. So the user can easily to check where can buy the mask. And more information here, you can show the open hour. You might take the direction, or maybe take just call the pharmacy to check again. So it's at the February 6th, the first day launch, there are over 800,000 page view in one day. Until now, the total page view are 50 million and still growing. This case is also broadcast to many countries, such as Korea, Japan, Thailand, and United States. Actually, Taiwan government doing really well in this epidemic. I believe this project give a huge inspiration to many people. They know they can do something help. It's a power from the civil movement, from bottom to top. Everyone is treated as their own responsibility to protect our home, our family, and our country. And this is my favorite photo during this period. And that's Audrey invited by CSIS in United States. And she tell our story to them. And we are very proud of what we are doing, and Taiwan really can help. Yeah, thank you. Back to Jenny and Joey.
Howard, we love how you saw the gap and just rise up to the occasion and led this community initiative. Thank you so much for doing that. You know, I was really inspired by this. So we've got a question from the audience. This actually came up during earlier today. So they asked, how could I start doing a project if I'm still a beginner, especially related to COVID-19 related issues?
Actually, in the COVID-19 channel, not everybody are developer. They might be a designer, or they may be a copywriter, or they can help to translator. Like we have overseas report ask the question, but most of us, our language, our native language is English, so maybe we just type in Chinese, and somebody will help you to translate to English. Yeah.
Okay, thank you so much, Howard, and all three of our speakers. You know, Howard, if you don't mind jumping to the live chat, I think there's still some questions there, but we're going to wrap up for today. And thank you so much, all of you, for joining us.
Thank you.
Thanks, Howard.
So once again, we're very excited that today we have three amazing speakers join us tonight. Their presentation slides will be available on our website over the next couple of days. So do stay connected with us by signing up to our mailing list on our website, or follow us on Facebook and Twitter.
So we want to hear your feedback about this event. And if you're based in Singapore, don't forget to leave your mailing address for us to send you special Google Developer Swags. For information, we will also be holding our first AMA session with Dr. Lau of coronatracker.com, the web portal and aggregator to obtain the latest information and updates on COVID-19. So stay tuned and join us for our next event. Meanwhile, stay safe, everyone, and we look forward to the day we can connect with you in person again.
Yeah, we miss you. Bye.
Bye, everyone.